So at this point, the patient has been brought into the laser suite, and one of our technicians is cleaning her eyes. These are some numbing drops that are going in to both eyes. She's using a betadine swab to clean and prep her eyes, getting her eyelashes nice and clean. This is a very important part of the procedure. So she's got a warm blanket on, and this is me entering the room here. And there's usually 3 or 4 technicians helping with the laser procedure. And now the patient is getting prepped. She's now prepped, and the technician is moving her head underneath the laser. The laser on the left here, or this machine on the left, is what we call the femto laser, and that's going to be creating the flap on the surface of the eye. We're getting everything lined up. First thing we're going to do is just position the head. We're going to be working on the right eye. I'm just rotating her head slightly to the left. And you can see the eye in focus on the video screen in the back of the room there. And we have a technician right there talking to her about what's happening. We're going to put one last set of numbing drops in here. I'm going to put a device on the eye that basically holds the eyes still. So there you see the suction ring being applied. So everything's getting centered up. You can see a cone of light. At this point, I'm asking the patient to look right in the center of the cone of light. As the patient, you would feel some pressure. You would be looking straight ahead. We were talking to you about the pressure sensation that you're feeling. No sharp pain, but definitely some pressure. And now we're just adjusting the parameters of the flap. You can see now the flap being created. These are tiny little micro bubbles that are being created in the cornea by the laser. You can see it's not a complete circle. Over to the right, there's a hinge, and that hinge is where we'll be reflecting that flap back. So the flap is complete. Now you can see the whole unit. The microscope, if you look, went up. And now we'll take that unit off, and we'll then proceed with the second eye. So now we've created the flap on both eyes, and you can see the bed moving over to the second laser, which is actually the treatment lasers. So we always start in eye surgery in general. If we're doing both eyes, we usually start with the right eye, and you can see we've got a shield over the left eye there to get prepped. So I'm just kind of centering the head here. On the first laser, we actually rotate the head. And the second laser, we keep it nice and neutral and straight ahead. So right now, we're getting ready to do the actual treatment on the surface of the eye. We're getting everything lined up. You can see the eye on the screen there, just past the technician. The technician and I are confirming the treatments, and we're reading out loud to make sure we have the correct patient, the correct eye, and the correct treatment. And so we're confirming that before we proceed at this point to make sure the treatment we do is the correct treatment. Now that the treatment is confirmed, we're going to move to the eye, and you'll see we'll put some more numbing drops in at this point, and you'll see on the monitor there, the eye being open, there's some more numbing drops. So we're putting in numbing drops throughout the procedure. So now some sterile gloves. The technician there talking to the patient about what's happening. We try to keep talking to the patient the whole time, just to be sure that they know we're aware that they know what's going on, or that we're making them aware about what's going on, which helps decrease any kind of anxiety during the procedure. Of course, the patients also probably receive some Valium about 30 minutes prior to coming into the operating suite. We don't like to give too much because, especially on this portion of the laser, you can see there's a little red light right in the center there. We're asking the patient to look right straight ahead. At this point, we're just washing some of the mucus and proteins off the surface of the eye. And you'll see at this point a Wexel, which is a kind of low sponge wipe that we use to wipe away all of the mucus and the oils on the surface of the eye. So now I'm just scoring or kind of marking the edge of the flap here with a tiny little instrument. At this point, the patient doesn't feel really this because we've got numbing drops, and the surface of the eye is very easily anesthetized. And now we're getting the flap out of the way. That flap of tissue is 1/10 of a millimeter, just so you get an idea how thin it is, but yet how strong it is. Human tissue really is amazing. So now we're drying off the surface of the eye that we're going to actually do the laser treatment. And I'm having the patient just look straight ahead. There's a little flashing green light that she's looking at this point. And we're getting everything centered. Off to the right, there's a tiny blue screen that you'll see just to the right of my head. That's one of the technicians is driving that screen to make sure that we have everything centered. And then you can see that blue screen change. And we're just making sure that the pupil is tracked. There's a device on this machine that tracks the patient's movement. So any kind of micro movement she's making, we're following that. We're also making sure the eye's not rotated at all from the laying down piece. And that is the actual treatment happening right now. The center you can see is changing color. That's the actual treatment taking place. And I believe the treatment is now complete. You'll see we'll put a little bit of water on the surface of the eye and then reflect that flap back over to get the eye back to its preoperative state as far as the flap, and just brushing that flap down. And these flaps really are amazing when we create them with laser because they're square edge, so they really want to sit back where they came from. So now I'm going to use a Wexel to dry off the edge of the flap, and that helps create a good adhesion between the edge of the flap and the edge of the cornea from which the flap was created. Once the flap is secure, you'll see us then put some antibiotic drops and a little bit of anti-inflammatory drops right on the surface of the eyes. And then we'll take the speculum out. That's that little wire device that helps us keep the eye open. We're now in a point where both eyes have had surgery and the patient is going to be seen in the exam room to make sure that both flaps look well secured. She will then be given instructions to go home and keep her eyes closed for a couple hours, and then we'll see her back that same day, later in the afternoon.